Hey guys, it's AG with nursingforall.com and Hurst Review Services. Do you remember earlier this week when we were talking about sequencing questions and how you tackle those the Hurst Review way? Well, we talked about proven strategies that we use at Hurst Review to answer these kinds of questions. Well, we're going to do a priority style question today, so let's use those Hurst strategies to answer this question. All right, so here's your question. After receiving report on an assigned client, in what order should the nurse assess these clients? Place in priority order from first to last. All right, so here are your options. Post-op abdominal hysterectomy client needing a dressing change due to a quarter size amount of bloody drainage. Your next option is client scheduled for an EGD requesting more information about the procedure that is scheduled for today. The next one is client with pneumonia who reports difficulty breathing. Our next option is a client who is 6 hours post-tracheostomy with copious amounts of sputum. We also have a new admit diagnosed with stable chronic angina reporting chest pain. All right, so here is how you are going to approach this question. First of all, you're going to look at the options. Out of these 5 clients, which one could die first if the nurse does not intervene? So what you need to do is go back to your ABCs: airway, breathing, circulation, then bleeding, and shock. So who could die? Number 4, that's right, that is airway. Now look at the other 4 options that are left and ask yourself the same question. Who could die? Well, if you do this for the last 3 options, then the last 2, etc., on, and let's see what you come up with. All right, so now our correct order that's left would be 4, 3, 5, 1, and 2. Okay, 4's got to be first because remember, they're a tracheostomy client with lots of sputum. That is an airway problem. They could die first. Next would be our client with pneumonia who reports trouble breathing. That is a breathing problem. Okay, if those 2 weren't an option, the next person I would see is my new admit diagnosed with chronic stable angina who's saying that they have some chest pain. That is a circulation problem. Now, out of the 2 that are left, I would need to go and see my number 1, the post-op hysterectomy client needing a dressing change due to a quarter size amount of bloody drainage. Guys, that is bleeding. That's a bleeding problem. And then last but certainly not least, I would go and see my client number 2, the one that is scheduled for an EGD requesting more information about the procedure that is scheduled for today. That is teaching, and that is always last. See, now you know how to answer the best way for this sequencing question, and that is the Hurst Review way. All right, guys, that's it. Make sure you tune in every Tuesday and Thursday for more Hurst Review strategies and NCLEX tips. And be sure to follow Hurst Review Services and me on all of your social media outlets. Peace out, players.